the agenda for today is me just to welcome you, and in a few moments I'm delighted to hand over to our chair, who'll have a look at our activities and achievements and quickly go through the minutes of last year, which you've all had. I'll then have a quick look at the highlights from last year, and there's quite a lot, and quickly again give you a heads up as to what's happened with the membership survey that you all completed. We still have to analyse the results properly, but again, that's something that we'll be in communication with you members about very shortly. And then I'm going to hand over to Isaac, who's here with us, who's going to give you the Treasurer's report from last year. Thank you all of you who participated in the voting that was as part of the AGM documentation. So I will give you the results of those when we get to that point, and then give you a heads up on what we're trying to achieve this year and what's happening at the Patients Association. And then myself and Anne will hope to answer as many questions as possible that you can do. So without any other ado, I'm delighted to hand you over to Anne. Anne, thanks so much.
Thank you, Rachel, and welcome everybody to 2023's AGM. And myself, if I can introduce myself to you, I am, of course, your chair that was appointed in January after the wonderful service that Lucy gave to everybody. And she isn't an easy act to follow because she's a very, very good chair. And I'm hoping I'll bring something a bit different, but at the same time, really acknowledge the work that you as members and as a team, the Patients Association does. Because without a doubt, this is such a busy time, a busy keeping up with announcements, busy responding to announcements, busy dealing with consultations, making sure, in other words, that the patient's voice is always heard. And as a nurse, I still have my registration at the NMC as a district nurse. I know how important partnership is, and I am delighted to read the reports of the past and know of what's happening in the present with this team, and they are excellent. I am privileged to work with this team, and I am really looking forward to an even busier year. Who knows what's going to happen in the future? We've got A1 to deal with, we've got AI to deal with, we've got so much with apps and virtual wards and possible wards and new hospitals, not new hospitals, what's being done, who's prescribing what and who's doing what to whom. But what we do know is that we should be doing it together in partnership always, because gone are the days, long gone are the days, when we did things to people and told them what they were doing, rather than how we should be treating people with respect, dignity, management of their healthcare, helping them to understand what's going on in what can be such a complex system, where abbreviations are used all the time, and we assume, health professionals assume, that you all understand what we're going to do to you. And it doesn't work like that. And it never should have, but it definitely won't do in the present and into the future. So I look forward to this AGM. I'm going to ask you now about the minutes of the 2022 meeting and see if you can agree them or if there's any questions arising. So that's the first part of my duty today. If there aren't any questions, can I have a mover and a seconder, please? And could you state your name? Rachel.
So just to confirm, in the letter that went out to the AGM, that the voting that Holly's passed on to me, we had votes, we had 30 votes to receive and approve the minutes of the AGM. So unless anyone else here, like you said, wants to say anything.
Oh, that's excellent. It means that we can progress to what Rachel's going to update us on. And I look forward to that too. Rachel.
Thank you. So Thanks a million, Anne, and it's great to be working with you. And everything you said there is part of our history, isn't it? And unfortunately, what we still hear from patients quite a lot that this. So we in 2022, I'm going to get the year wrong, I know I am. We did a lot of work around our theory of change, and our theory of change looked at actually what impact can we bring as an organisation, and we really felt that what we needed to do was to work towards patient partnership in the design and delivery of services. And I know that Anne and I have spoken a lot about that because, you know, if services are designed with patients in true partnership, they will be better services. They'll be more motivational for a very hardworking workforce out there, but they will have better outcomes for patients and staff, but they'll also be safer services. So we continue to work towards patient partnership. And as part of that patient partnership, we've done a lot of work in the last year around shared decision making, because shared decision making has to be the first step. And that is where, you know, patients and healthcare professionals start together in understanding what matters to that patient. And I think that's a really important question that a lot of patients tell us that they don't hear when they're interacting with their healthcare professional, is that question of, you know, I am more than my illness, and I am more than the condition that I have. I am a person, and how do I live my life to the full? So thank you. As part of that, we then started to look at developing the principles and the characteristics of patient partnership. And we did that with a number of our members and a wider audience of patients. So thank you so much for helping us with that. And what we'll be launching very shortly to you as a membership is actually what we think needs to be in place for those principles of patient partnership to be achieved. And we'll make sure that we put a copy of those principles in the chat shortly for you. So we continue as an organisation. We're still a very, very small team. The team consists of me as Chief Executive. Maya's on this call as my Head of Comms and Marketing. Sarah, our Head of Patient Partnership, is actually in Liverpool today with some members, discussing the outpatients transformation work that's going on to make sure that patient voices are at the centre of the new outpatient strategy. So that's really exciting, but she's disappointed not to be here. Shivani can't say hello, who leads on all the patient projects that we have run over the last year. She's on as a participant, so she doesn't get to say hello. Maybe she can say hello in the chat. And it's really good to see that we do have some PPGs on the call. So thank you so much, all of you, for joining. But on our website, you'll see a huge piece of work that started last year around PPGs, and that started with Hearts ICCS, and some of you joined a meeting last November that we showed you the outcomes of that. But that was the role of PPGs and how to increase the diversity of PPGs. And again, we'll link to that in the chat just in case some of you who've attended aren't there. So we've spent a lot of time last year making sure that we were listening to patients and that we were really looking at how we could widen the variety of patients. And we just had a seminar on the virtual wards just before this, which some of you will have joined. But, you know, one of the issues that came up there was people with inequalities and patients with inequalities. And our chair was chairing that as well. And she was asking about how do we make sure that virtual wards looked at, you know, access and inequalities. And we spend our time as a patient association making sure that we are doing that. So we do that by going out and talking to a huge amount of different and smaller patient organisations and making sure that they can lend their voice to us and that we can make sure that we as an organisation represent those voices. So some of the ones are mentioned in the slide here, but there's many more. But the Maternal Mental Health Alliance, Pain UK, Mental Health Forum and the Rural Services Network. So making sure that we're looking at inequalities from more than at a wider lens, and also looking at, you know, geography as part of that. So we still sit in a number of groups, and following early next week we'll be sending you out a copy of our annual review from last year. But we champion patients' views, and I am honoured all the time when I sit at NHS tables and and talk about what I'm hearing from patients, because we really are representing patients' views and comments, and just making sure that we can be the conduit to that voice. So a lot of work done with the NHS Assembly, and you'll have seen in our membership, in our weekly news last week, the conversation guide that's out there for you to give views into the NHS Assembly as well. The Elective Recovery Task Force, making sure that we're really bringing patient voice to the table. And then we have our wonderful helpline, and our helpline continues to hear numbers of calls around, and they all come down to the bit that Anne was talking about earlier, which is around communication, signposting, finding their way around the system and getting access to the services that they need. And so that was 3,500 calls in the last year. And then our online information and guidance, which is a huge part of the helpline, and the information and support services that we provide, was viewed more than 100,000 times last year. So for an organisation of less than 10 people, this is a lot of work that we are trying to do. If we just go on to the next slide. Thank you. So a huge part of what we work, if for those of you who've been around for quite a while with us, when I joined the Patient Association coming up to 6 years ago, we had 300 odd members. We now have 3,500, and so that's fantastic, but we want more, and we need your help as our members to really raise the voice. It's free membership, it's there, it's a way of you working with us, and really trying to work out how we can become a team. But members are so much more involved than they were at the beginning, so I'm really delighted about that. But I am not resting on our laurels. We have lots more, and our chair and trustees have helped to agree with us that we want to really get that number up and really diversify the membership too, because it's not just about numbers, it's about diversity of voice that we have through that membership. But because you kindly filled in our membership, we're not ready to announce the full results, but I really felt that we wanted to just give you some headlines while we had you here. So 1 and 2, over half of you joined Campaign for Improvements in Health and Care, and that's great, and we are using your voice. And I want to thank the members that Maya have come back to Maya, who were part of that kind of rapid response, and so that we can just quickly shoot out a question. And the reason we did the virtual awards event just prior to this AGM was because through that rapid response of members, they asked some questions about virtual awards. We were being asked by the media about virtual awards, and we wanted to hear from our members what they thought and what they needed to know. And so when we got the answers back, we thought, well, actually a webinar is a really good thing, and we intend to do lots more of these this year. The demographic survey, you can see there that we really need to think about how we can make that more visual for members, because some people didn't see that it existed, and what we didn't want to do was to force people to complete the survey to become members, but we are going to look at how we can make sure that that's much more visible to members as they apply, and we will look back before 2022 in time to see if we can look at retrospectively getting the demographics filled in by previous members. So delighted that you all want to help us to raise our membership numbers, and we will send you out some more information on that. But any ideas that you want to just quickly stick in the chat about how we can raise our membership numbers, we'll take it all on board, and we'll work to try and achieve that. We want to try and raise the numbers of the low number of people attending our events. They're very well attended, but we will probably come and ask you more about the type of events that you want to attend. But just to tell you that we are going to be coming out to you very soon with our Patient Partnership Week, and we initiated that last year as a week of events to showcase the great work that patients and the healthcare system were doing together to design and deliver services. because again, we cannot do this on our own, and we have to work with frontline healthcare professionals who are doing so much to give care to patients and to work in partnership with patients. So if you've any ideas, again, as our membership, about what you'd like to see in that patient partnership week, please do let us know. I haven't got the dates to hand, but it's sometime in September, and we will be in touch with you. And the focus will be very much about some of the work that we're doing in shared decision making, some of the work that we're doing around patient partnership and our principles of patient partnership. And one of the things that's coming up a lot with people right now is the role of consent and the shared decision making and consent. And I think there's things coming in already, so that's good. Thank you so much for all the surveys and the campaigns that we are that we have launched. We've sent you out the details of the one that we did earlier this year, and we'll be launching another survey again this year. And you know, it's really important that we hear back from you, because without your voice, I can't walk into a room and tell people what I think patients are experiencing or wanting. So we come out to you to ask you all those questions, so that I have the knowledge and what patients are saying. So we're doing that through a variety of different ways, including the work that we've done with our lived experience advisory panel. And Edwin, yeah, we have tried to promote patient association with patient participation groups. Again, the size of us is so small that trying to market things in that way, but that's something we're trying to do through all the work that we're doing with Hearts, and we get other ICSs to pick up that great work that's happened and spread that. But yes, it's a good way. So you have given us some ideas about how we might improve our membership, and I need to sit down and go through those and look at the impact of the work that we're doing, and look at more ways of gaining opportunities to work really closely and directly with you. And that includes, you know, me trying to get out. So if you've ideas where the patient association should be represented more on a UK wide, we have last year reached out to Scotland to try and work closer there. We've reached out to Wales. We now have Anne, she's Welsh, so she can help us get out there, get a bit more as well. And Northern Ireland, obviously, and you get my accent. So, you know, we do need to think about how we can reach out and how we can raise that, because, you know, it's like Anne said, there is so much going on in health and social care at this moment in time, and we absolutely need that social movement to make sure that every patient, regardless of their background, receives help and care that allows them to live their life to the full, and that's the most important and what matters to them. So that's fantastic. If we move on to the next slide, please. So Isaac, it's your moment of glory, and I just hand you over to our treasurer.
Good afternoon, everyone, and welcome to this year's AGM. I'll quickly take you through the main points of the annual accounts, which will subsequently be filed at Companies House in the next couple of weeks or so. We started the year with great difficulty, as you all know, with the cost of living and just coming out of COVID. So things haven't been too easy. Nevertheless, during the year, we were able to increase our reserves from the previous year of £178,000 approximately to 248,000. And during the last financial year, we had income coming in of 638,000 approximately, and that mainly comes from corporate membership, funds from projects that we undertake, and some contributions from members, which is voluntary, and also some legacy funds, which some members have kindly left for us. And in terms of expenditure, again, this we had to control very, very strictly, due to the fact that we are not sure how income is going to come in, either from our corporate members or from the projects we're undertaking. So expenditure was tightly controlled, and we managed to keep it more or less in the same level as the previous year, but just under, to £577,682, thereby giving us a surplus in that year of 60,000, which is less than what we had in previous year. However, our reserves as at the end of the year was £308,987. Now, this seems like a lot of money, and yes, it is a lot of money, but we have a lot of work to do for you members. As the chief executive have just told us, and as the chair said in our opening speech, there is a lot we've done, and there's so much more we can do and we intend to do in order to fulfill our strategy. Now, with the cost of living, we also have to bear in mind that rising costs does not help. Organizations have difficulties, and how they would contribute or how they will continue to be members is something that we have no control over. So we do need to have a reasonable and healthy reserves in order to provide the services that we are providing for you to be your voice. So I would, at this juncture, end my short presentation on the highlights. But before I actually go, it will be comforting to tell members that our independent auditors are in no doubt that what we presented to you enables us as a going concern to continue operating as a going entity. And they are satisfied with the level of research we're keeping and ensuring that we've been prudent enough to make sure that the impact of the cost of living does not seriously affect the delivery of our strategy. So thank you so much for listening to me. Thank you.
Thank you, Isaac. Thank you so much, Isaac. It's very, very clear. Are there any questions to Isaac?
There was one question in the chat about the variety of, about how we receive our income, which we've answered in the chat to everybody.
Okay.
But if people have other ideas, the other thing that we need to this year, and we're looking at, and previous years, especially with COVID, it was really difficult, but is to look at grant and trusts to apply for money from them. But now that we have that wealth of patient experience, this is the year that we feel that we can do that. For the last few years, they were very much focused on the ground, COVID recovery, local support groups, rightly so. So this year we'll be looking at that, and we've been looking at some of the bigger grant givers as well in prep as part of our fundraising strategy over the next few years to look at people like the Big Lottery Fund, etc.
Good, excellent, excellent. So,
fantastic. I don't think there's any more questions for you. And just to say, in the voting that went out in the papers before the AGM, Isaac, it was agreed to receive the report and accounts for 2022. So that was overwhelmingly voted in favour of. And also it was overwhelmingly voted in favour to approve the appointment of MHS McIntyre Hudson, our independent examiners, as our auditors for this year, and to fix their remuneration, for the trustees to have the right to fix their remuneration.
good.
I hope that helps.
Excellent.
Brilliant. And then the other bit in our, so I've reported on majority of the membership through the presentations. But as Anne said, she joined us at the beginning of December and went through a rigorous recruitment process, as do all our trustees, in an open and transparent way to make sure that we bring in diversity of voice. And I'm delighted to say that Anne was approved to be appointed. Well done, Anne. And every 3 years we need to re-elect our trustees one time, so they can stay for two periods. And the trustee up for election was Suzanne White, who unfortunately couldn't be with us today, and has given her apologies, but she was also unanimously approved to be re-elected as a trustee at the Patients Association. So I'm delighted for both of them, and I'm sure that the membership are delighted too.
Absolutely. Brings a wealth of knowledge. Wealth of knowledge.
Brilliant. So we move on to the next slide. Fantastic. So as you can see, Dan is the chair of the trustees and is just now elected, formally elected as a trustee as well. And our work this year is very much to continue to raise the voice of patients, to raise those concerns that we're hearing through our helpline, through our survey. And the recent bits that we've been hearing a lot about is that lack of choice that patients are having, and you know, that and that whole shared decision making, and when we talk to frontline professionals, we see the passion for shared decision making and for patient partnership. So we've got to do more this year to really look at embedding it. And last year we did a survey with healthcare professionals to understand their views of shared decision making, and you know, the 3 barriers that they highlighted for us was resourcing, that 10-minute appointment, especially with the GP, staffing resource, and the IT systems, the circle of doom, as a lot of healthcare professionals describe, being able to see the whole, the person's record. So late last year, we did a webinar on, at least I think it was late last year, somebody's going to tell me I got this wrong, but we did a webinar on NHS, the NHS app and accessing your medical records. And one of the things that really, one of the highest downloads last year was around people wanting to, how do you access your medical records? And they're your records. So we will continue with webinars in March. Thank you. This year is going too fast. It felt like it was last year. But, you know, it's really, really important around that these are patients' records. So we're going to continue working with NHS England to make sure that, you know, GP practices allow that. And we're going to work with NHS England and the different professions, because within the shared decision-making report, you know, there was different professions in there that thought more about shared decision-making. So, for example, nurses were like the most positive about shared decision-making. So we need to work on that to understand why that is, because that's very much of we have to work together in partnership. And I've just spent 2 days at a patient partnership conference that really highlighted the need for health and care professionals to do that. So patient partnership will remain a huge part of our work this year, and we have a few very big projects that we're doing at the moment that we've been commissioned on. So we'll be having more webinars with you all to give you the outputs of those, and one of the outputs of those at the moment is going on is the work on the outpatient strategy, which is why Sarah's in Liverpool today, and there's more work going on in that, and you know, really understanding how patients want to receive their care, what barriers are in place are really, really important. We need to increase our profile. So, you know, thank you so much for attending. And yes, Emma, that would be great. I was just about talking increasing our profile, and in the chat, I think all current mentals could advertise the PA a QR code to the website in a banner we could use in our media. That's an amazing idea. So we will definitely try, and I'm really excited by that. So we will definitely try and do that. Maya's now going, how would we do this? How would we do this? But we will find a way. We also want to do a lot of work with helping. So the bit about patient partnership is very much about giving patients power. And then patients decide who they share that power with, and they will share that power with our healthcare professional. Of course they will, but we need to do you mind Maya saying she doesn't know how to QR code us? I didn't know. So we do want to do a lot about, you know, how do we give patients power? And one of the lovely examples today in Liverpool are the patients that are there. They now are sitting in a room with decision makers, giving their view and giving their points across, and that's just what we need to do more of. We are looking to provide more high quality information and guidance for patients, and more on what we hear from patients. So the virtual ward today will hopefully result in some more information on our website for patients, so that we can really answer some of the queries, because a lot of the queries in the virtual ward this morning was around you know, who can access a virtual ward? How do virtual wards work? So we need to make sure that we do that. And if you go on our website right now, we know if we've just launched a really lovely video about how to make a complaint. And you know, a lot of the calls coming through to our helpline are very much about making complaints. And that's because patients don't feel listened to and heard. And that's something we need to really advocate on behalf of patients with NHS England and with local ICSs and build on the work that's already happening there. And then Isaac, do you want to say something about the financial health of the charity?
Yes, Rachel, thank you very much. I mean, as you all heard when I did my short presentation, for the current year, we continue to strive to ensure that the financial health of the organization is strong. And this is done by us being very prudent and being very careful to make sure that every penny we spend on this fantastic job that we're all undertaking in partnership does stretch as far as possible in order to have an impact on the health and well-being of the patients that we are a voice for. So as I said earlier, the independent auditors have verified and are happy that we are a going concern. We manage our finances and resources very, very carefully and very prudent. And in the next 12 months, at least as far as the examiner are concerned, we are in good shape financially. Nevertheless, the difficulties of the cost of living, inflation, which is still very high, even though it's gone down slightly, does not immune us from all the difficulties and challenges. And as an organization, we want to increase the membership. Hence, we encourage members to be part of us without any membership fee. And we're happy to continue doing that. But at the same time, support from members will go a long way and we'll always appreciate it. It's never too much. And I can assure you that your money is in very good hands. Thank you.
So if we move on to the next slide, and myself and Anne will attempt to, well, actually one of the questions I'm just going to mutually give to Anne because I think she'll answer it much better than I will. So Anne, in the question box, one of the Jessica says that, you know, the real important thing is reaching out to hospital trust to see how we can get patients on the front line. We are relaunching our digital coalition this year, but this member is saying, you know, patients feel so powerless when they're in hospital. And I've often thought about that point because, you know, we're such a small team and there are pals there that's meant to be supporting, but getting in touch with, you know, and one of the issues we hear in our helpline quite a bit is it depends on which pals you talk to. It's not consistent. So how would you think that we might be able to, you know, reach hospital trusts in a different way?
Right. Well, I'll do my best with this. You know, PALS, of course, is the front line people to go to, but they're not always easy to find or to approach because they're not in their office or it's a recorded message when you telephone. I think depending on what it is that you want to either ask about, be made more aware of, or whatever the situation is. Let's look at, say, 3 different scenarios. If it's about a member of staff that you don't feel that is getting on with the patient, or you're not getting on well with the patient, the person in charge of the ward is the person to say that to. Usually communication is at the root of most complaints. But poor communication. Something has been said or not said, or equally, the member of staff has forgotten to go back and explain. And that's quite common. And I hear that from nurses when I listen to the helpline for nurses who say they are aware that they're not able to give the care they want to give because they haven't had breaks, there isn't the number of staffing levels. There is no, there's no safe staffing levels in England. And when you're on an aeroplane, the aeroplane will not take off unless it's got the adequate cabin crew for the number of passengers. We don't have that safety measure when we have a number of patients, and how many nurses do we have, medics and others do we have to that patient. And I know there is a big campaign asking about that. If it's
Thanks,
a
Anne.
serious complaint, well, then you're a member of parliament, without question. You actually have the right to take a complaint to the member of parliament, who will then take it up for you at no cost. So don't go hiring lawyers or anything of that nature, because you can discuss that with the member of parliament. You can also ask to see the CEO. But if you could get to the members of staff that's most appropriate to say, can we sit down and have a chat? Make notes what you want to say, because you'll forget otherwise, and see if you can get that personal appointment.
Brilliant, Anne. That's really, really helpful. And I think, what I'm seeing in some of the chats and the messaging here is that maybe we need to think more about how, because people are saying it's patchy, but somebody's in a hospital bed, they're worried about something, how can they access us to give them information and guidance? So we'll
say, if you don't know what the complaint is, if anybody could be more specific with me, I would know how.
I think people are saying it's a variety. It's about loneliness and things not going right. So I don't think anyone, and of course the other people that are out there are AVMA, and they provide an advice line for patients. They're one of our partner patient charities. And they're there to kind of give advice around. So we'll put a copy of that into. So I think what we'll take away that question about actually how can we support patients whilst they're in maybe acute care and need some advice while they're in there, and just making sure that we're advertising. I think some of you have agreed to take away. The other thing we'd love to hear from members on there is how might we get the information around our helpline out there more into local hospitals and local trusts as well.
It's very intimidating to complain if you're an inpatient.
Yeah, I can imagine. Yeah. You're reliant, aren't you, Anne? You're reliant on them. And then I remember that in my past doing complaints training in palliative care. It's scary to raise a complaint. Very mindful that we're coming to the end of the time, so I'm just going to quickly check the other questions. There's a couple of questions in there, and Maya, that I think we're not going to get to because they're quite complex. But can we just put the helpline number in there so that people have our helpline number as well, and the email address that we can do that. Definitely, I think, Anne, you and I need to discuss further the kind of issue with PALS that's coming up quite a lot in the chat, and how we might work on raising that profile and looking at how you might have some ideas for me through our supervision about how we might raise our profile there as well.
I mean, today's healthcare is under so much pressure. It's not an excuse, and things will go wrong. Things are going wrong. So how best to manage it when it does go wrong is critical for people to be aware of, even though I see from the chat box that they are not really feel strong enough to complain. You can't complain if you haven't got the facts, if you haven't got the knowledge. You can't feel confident. And that's what PALS were there for. And they're either excellent or average, or sometimes below average. And that shouldn't be the case.
So, Anne, we've come to the last couple of minutes of our AGM. As Chief Executive, I want to thank all our members and the team, but is there anything you'd like to say about our
Well,
next year?
I've just seen a really good comment in the chat box, which I endorse. To get good care, you've got to care for staff.
Yeah.
And I was privileged last year to be on a webinar with the World Health Organization and the chief nurse of the World Health Organization. And she was asked, not by myself, what would make your legacy feel good to you? What do you want to mostly achieve? And her answer from the World Health Nurse was that nurses are looked after because happy nurses will deliver very good care. You can't do it without looking after staff. So whoever put that in the chat box, I totally endorse it. And I think this coming year of our 60 years, we've really got to make sure that our voice is heard loud, and it's in total partnership with our patients, who are our families. They are our own family, they are ourselves. So whatever we do with our own people in mind. And that's how you should view. Good health isn't just a toast. It's what we want for everybody. And thank you to all of you in participation today.
Well, what a wonderful way to finish. Thank you all so much. And we will follow up on the questions that we haven't got to and come back.